New novel cell therapy could resolve osteoarthritis. Scientists have created a promising injectable cell therapy to treat osteoarthritis that both reduces inflammation and also regenerates articular cartilage. Osteoarthritis is typically induced by mechanical or traumatic stress in the joint, leading to damaged cartilage that cannot be repaired naturally. Osteoarthritis is a disease of the joint system. The joint includes a synovial membrane, a connective tissue that lines the inner surface of the joint. The membrane functions to protect the joint and secretes a lubricating fluid filled with cell elements needed to maintain a healthy environment and to provide friction-free movement. In healthy joints, when an injury occurs, the body recruits an army of inflammatory cells and sends them to the injury site to contribute to cleaning of the damaged tissues. In the osteoarthritic joint, however, a traumatic injury leads to inflammation of the synovial membrane and cartilage damage. With time, the inflammation worsens, leading to degradation of the cartilage lining the joint bones and chronic inflammation in the surrounding tissues. For patients, this causes severe pain, swelling, and often limits daily activities. The team isolated cells from the joint fluid of osteoarthritic patients, separated the cells from the fluid, and investigated them alone, but also in the presence of the autologous fluid. Separated from the fluid, they saw that the cells had the ability to undergo processes required for functional tissue repair. When they added a small percentage of the fluid back into the cell culture assay, the cells' abilities were impaired. They couldn't do their job, suggesting that the specific osteoarthritic environment stops them. Based on these findings and what is known about functional tissue repair, a cell therapy was designed that can overcome the inflammatory environment and also regenerate cartilage. Cartilage-activated immune cells that target inflammation, combined with progenitor cells, aid tissue regeneration. The combination of cells leads to simultaneous treatment of several of the aspects involved in osteoarthritis: synovial inflammation, cartilage degradation, subchondral bone sclerosis, and innervation of pain-sensory neurons. The therapy was tested in a preclinical model and was found to have the ability to reverse cartilage damage in the synovial membrane and diminish the inflammation as well. To evaluate clinical efficacy, a compassionate use study was conducted in 9 patients with confirmed osteoarthritis, who each received 1 or 2 injections. Efficacy was evaluated through scoring of pain and functional living, MRI scans pre- and post-treatment, and a biopsy from 1 patient was obtained. Once treated, the patients experienced improved quality of life, ability to participate in recreational activities, and reduced pain. Additionally, MRI studies confirmed cartilage regeneration. For further information, management and treatment, please contact Dr. Sanjeev on WhatsApp 9323758869. Novel immunotherapy improves recovery from spinal cord injury. Severe injuries to the spinal cord damage nerve cells, disrupt communication with the brain and rest of the body, and lead to lasting disabilities for millions of people worldwide. The injury itself accounts for only a fraction of the overall damage inflicted on the spinal cord, tissue that runs from the brainstem to the lower back. Most of the damage is due to subsequent degenerative processes at the wound. While there is substantial research into developing interventions to repair injured tissue, scientists at Washington University School of Medicine in St. Louis focused instead on developing an immunotherapy to minimize the damage from traumatic spinal cord injury. Their findings show that immunotherapy can lessen such damage by protecting neurons at the injury site from being attacked by immune cells, presents a novel approach with potential to help improve outcomes for people recovering from spinal cord injuries. Shortly after injury to the nervous system, immune cells flood the site. Among them is a mixture of activated T cells, a subset of immune cells that either harm or protect the surrounding neurons. The protective T cells that swoop into the injury site can mistakenly attack the body's surrounding tissues when activated for too long, causing autoimmune disease. Modified T cells had better mobility than did the untreated. The researchers saw the biggest improvements when infused with T cells within a week of the injury. None of the members receiving immunotherapy developed a destructive autoimmune reaction. Immunotherapy for such injuries, by taking advantage of the protective immune cells that infiltrate the injury site, and found that it dramatically improved mobility. For further opinion management or treatment, please connect Dr. Sanjeev on WhatsApp 9323275869.